My name is Terry King. I am the Chief of the Division of Breast Surgery at Brigham and Women's Hospital and Dana-Farber Cancer Institute, and the Vice Chair for Multidisciplinary Oncology. So breast reconstruction comes in two main forms. One is an implant-based approach, and the other is by using autologous tissue. With an implant-based approach, traditionally that has been performed in two stages, with the first stage being the placement of a tissue expander pocket of the breast, and notably to preserve the inframammary fold of the breast. So the tissue expander can be placed either in front of the muscle, which is called prepectoral placement, or behind the muscle, which is called subpectoral placement, and allows for the skin of the breast or the mastectomy flap skin to recover from the mastectomy procedure prior to placing the full weight of an implant on the skin. So the tissue expander, in the simplest terms, is an empty implant, but it has a port on it that allows for expansion over time. And so by placing the tissue expander at the initial operation when the mastectomy is performed, again, that allows for preservation of the breast pocket, preserving the inframammary fold. Then the expander undergoes a series of expansions once the patient has recovered from the immediate postoperative period. Once the breast mound has achieved the size that the patient desired, then that tissue expander is left in place for several weeks to just really allow that pocket around the implant to form. The tissue expander is then removed and replaced with a permanent implant as the final stages of reconstruction. So that's a two-stage approach with an implant using a tissue expander as the first step. There are some practices now that have transitioned more to what is referred to as a direct to implant option, where the tissue expander is not placed as the intermediate step. But traditionally, implant-based reconstruction has used a tissue expander to, again, allow the skin to recover from the mastectomy procedure and to really form the pocket for the final implant to live in. When a patient is not sure whether she would prefer implant-based reconstruction or autologous-based reconstruction, a tissue expander can also be used as an intermediate step to allow the mastectomy to be performed, the pathology to be determined, an assessment of whether the patient will require post-mastectomy radiotherapy or not. And if so, then that is typically given with the tissue expander in place, again, to preserve the skin and the breast pocket, but then still allows the patient to have the option of converting to autologous tissue reconstruction for her final procedure, or converting to implant reconstruction, again, for the final procedure. So the tissue expander is really just sort of, again, a holder, if you will, to preserve the skin of the breast, the pocket of the breast, and improves the cosmetic outcome with immediate breast reconstruction when you're able to preserve that pocket and that inframammary fold.